This recording will go over anti-anginal drugs. So what is angina? Angina pectoris is a condition of acute cardiac pain caused by inadequate blood flow to the myocardium due to either plaque occlusions within or spasms of the coronary arteries. With decreased blood flow, there is decrease in oxygen to the myocardium, which results in pain. So angina or angina pectoris, what we're talking about is chest pain that the patient is experiencing because that myocardial tissue isn't getting that oxygen-rich blood that it needs, and the patient then experiences chest pain. I'm not worried about you knowing the different types of angina, the classic, unstable, and variant. You do not need to know that for pharmacology testing purposes. I do want you to know the non-pharmacologic measures to control angina. Non-pharmacologic methods of decreasing anginal attacks are to avoid heavy meals, smoking, extreme weather changes, strenuous exercise, and emotional upset. Proper nutrition, moderate exercise only after consulting with a healthcare provider, adequate rest and relaxation techniques are used as preventative measures. 3 types of anti-anginal medications are nitrates, beta blockers, and calcium channel blockers. The major systemic effect of nitrates is a reduction of venous tone, which decreases the workload of the heart and promotes vasodilation. Your prototype anti-anginal nitrate drug that you need to know is nitroglycerin. It works by decreasing myocardial demand for oxygen, decreasing preload by dilating veins, and indirectly decreasing afterload. Patient teaching is important in regards to nitroglycerin. Many patients are prescribed sublingual nitroglycerin tablets, and they need to be provided the correct education as how to administer the medication. If the patient were to swallow the sublingual tablet, it would be rendered ineffective. In terms of the sublingual tablets, if the patient's experiencing angina pectoris or chest pain, they should administer 1 sublingual tablet under their tongue and allow it to dissolve. If the pain isn't relieved after that tablet, the patient would be instructed to call 911 and take a second tablet. So with these sublingual tablets, they can take up to 3 doses, 5 minutes apart, if the chest pain isn't going away or if the angina isn't going away. For testing purposes and according to your textbook, if the chest pain isn't relieved after that first dose after 5 minutes, the patient should seek medical attention and call 911. In the clinical setting, if you have a patient who's come in with chest pain and has taken a sublingual nitroglycerin, ask them how many, because they might have been told something different by their doctor. Again, they can take up to 3 on their own, so you want to be sure to know how many nitroglycerins they've taken prior to coming in for treatment. Sublingual tablets decompose when exposed to heat and light, so they must be kept in their original airtight glass container. The tablets themselves are normally dispensed in these original glass containers, which have screw top caps that are not childproof to facilitate emergency use by older adults who may have reduced dexterity. After a dose of nitroglycerin, the patient may experience dizziness, faintness, or headache as a result of peripheral vasodilation. If the patient is using a transdermal nitroglycerin patch, it should be applied once daily. It is important to note that the patch should be removed nightly to allow for 8 to 12 hours of nitrate-free intervals. This is necessary to avoid tolerance associated with uninterrupted use or continued dosage increases of nitrate preparations. Side effects for nitrates include hypotension. We want to teach patients that they should administer the nitrate for the first time while they're sitting or lying down, because we're worried about their safety in regards to standing up and becoming lightheaded and possibly having a syncopal episode. Also, headaches. Headaches are the most common side effect for nitroglycerin, but they may become less frequent with continued use. We want to teach our patients that headaches are a normal side effect, and it's due to that vasodilation, and they can treat nitrate-associated headaches with acetaminophen. When nitroglycerin ointment or transdermal patches are discontinued, the dose should be tapered over several weeks to prevent rebound effect of severe pain caused by myocardial ischemia, a lack of blood supply to the heart muscles. In addition, reflex tachycardia may occur if the nitrate is given too rapidly. The heart rate increases greatly because of overcompensation of the cardiovascular system. Beta blockers are another classification of drugs that are used to treat angina. Beta blockers decrease the workload of the heart and decrease oxygen demands. Your prototype beta blocker is acebutolol. Beta blockers are used as anti-anginal, antidysrhythmic, and antihypertensive drugs. Beta blockers are effective as anti-anginals because they decrease the heart rate and myocardial contractility, thus reducing the need for oxygen consumption and consequently reducing anginal pain. Your prototype, again, beta blocker in this chapter is acebutolol, and you recognize those beta blockers because of that LOL ending. I know this isn't the first time you guys have been exposed to beta blockers, so this part of the lecture will be kind of short. Beta blockers should not be abruptly discontinued. The dose should be tapered over a specific number of days to avoid reflex tachycardia and recurrence of anginal pain. And since we've already covered beta blockers in lecture, again, I'm not going to talk about it at length in this lecture, so please review beta blockers on your own to refresh a little bit. Calcium channel blockers are also used to treat angina. Calcium channel blockers relax coronary artery spasms and relax peripheral arterioles, which result in a decreased cardiac oxygen demand. They also decrease cardiac contractility with a negative inotropic effect, decrease afterload and peripheral resistance, and they reduce workload of the heart, which decreases the need for oxygen. Calcium channel blockers achieve their effect in controlling angina by relaxing coronary arteries and decreasing oxygen demand. The three medications you will need to recognize as calcium channel blockers are diltiazem, nifedipine, and often that IPINE is a ending that you'll see frequently in calcium channel blockers, and verapamil. The side effects of calcium channel blockers include headache, hypotension, dizziness, and flushing of the skin. Reflex tachycardia can occur as a result of hypotension. So what that means is the blood pressure goes down and the body tries to compensate by increasing the heart rate. Peripheral edema may occur with several calcium channel blockers. Calcium channel blockers can cause changes in liver and kidney function, so let's make sure we want to monitor those function tests. Please review the purple nursing process box for anti-anginals on your own. There's a couple of things I just want to make sure I point out. In terms of interventions, we want to monitor vital signs as hypotension is associated with most anti-anginal medications. Position the patient sitting or laying down when administering a nitrate for the first time. After administration, check vital signs while the patient's laying down and then sitting up, and have the patient rise slowly to a standing position. Small sip of water may be given for some sublingual nitrates if the patient is dry, because if it's dry, that medication won't dissolve. So if the patient has mouth dryness, you can give them a small sip of water prior to administering the sublingual nitrate. Monitor effects of IV nitroglycerin and report angina if pain continues. When using a nitroglycerin patch, do not touch the medication portion of the patch. Do not use fingers. When using an ointment, you want to make sure you use a tongue blade or gloves for that. Teach the patient again to take, if they're experiencing angina or chest pain, to take one sublingual nitro tablet and to call 911 if the pain has not subsided or has worsened in 5 minutes. Again, the teaching goes on to say, though, you can take up to 3 doses 5 minutes apart. In the clinical setting, make sure you have asked how many doses the patient has taken. Advise the patient not to ingest alcohol while taking nitroglycerin to avoid hypotension, weakness, and faintness. Advise the patient to notify the healthcare provider if chest pain is not completely alleviated. Tolerance to nitroglycerin can occur. Inform patients not to discontinue beta blockers or calcium channel blockers without healthcare provider's approval. Withdrawal symptoms such as reflex tachycardia and pain may be severe. Teach patients to store medication bottles away from light and a dry place and to keep the drug in its original screw cap, amber glass bottle. The amber color provides light protection, and the screw cap closure protects from moisture in the air, which can easily reduce tablet potency. Teach patients about nitroglycerin patches applied once a day, usually in the morning. Rotate skin sites. The patches usually apply to the chest wall, but thighs and arms may also be used. Avoid hairy areas. And again, with transdermal nitroglycerin patches, those need to be removed at night. Suggest acetaminophen for the relief of nitroglycerin-associated headaches. Place the patient in a supine position with legs elevated if hypotension results from sublingual nitroglycerin. Instruct patients on how to check their pulse regularly.